Good morning, everyone. I have the honor of welcoming you today to listening to the voices of stakeholders to identify research priorities for dementia care, our first virtual symposium. My name is Carol White, and I am a professor at UT Health School of Nursing and lead the Caring for the Caregiver program. This program supports families living with dementia using a strengths-based model of care. I think it is meaningful that this symposium is being held during the World Alzheimer's Month to raise awareness and challenge the stigma that surrounds dementia. And that's one of our objectives of hosting this symposium today. I would like to thank the Patient-Centered Outcomes Research Institute, or PCORI, for their funding, which has allowed us to conduct this project to identify priorities in dementia care research that includes the voices of our stakeholders, those with both a personal and a professional interest and stake in best dementia care. I also want to acknowledge the incredible work of our Stakeholder Advisory Council, who has been meeting with us regularly over the past 2 years to discuss their perspectives on dementia care, identify gaps, and then to reach out to their networks to identify topics that are important to dementia care research and to help us prioritize these topics. You can see that we represent a diverse group of people that have a vested interest in dementia care and best practice: family caregivers, care partners, people living with dementia, clinicians, community organizations, social professionals, researchers, and students. There's a picture you can see there of some of our Stakeholder Council advisory members, and you can see their names on the left-hand side, and we thank them for their hard work, and you'll be hearing from some of them later this morning. I also want to thank the Caring for the Caregiver team for their support in planning this symposium, and especially Sarah Massoud, who's been instrumental to this project and the symposium today. And thank you all for attending. As we listen to the voices of our stakeholders and what matters to them, we can truly transform dementia care. So just a couple of little housekeeping items before we get started. You'll see that the format for today is a webinar format, so your microphones are muted and only the speakers are visible. You will see also there's a chat box where you can communicate with us or with one another. And then there's a question and answer box, a Q&A box, where you will submit your questions, and we'll be monitoring those so that we can get to your questions. We'll also post during the presentation relative links that may be important for you in the chat box. So without further ado, I'd like to get started. I'm pleased to welcome our first speaker today. Rachel Andricosky is a Senior Program Associate in the Office of the Chief Engagement and Dissemination Officer at the Patient-Centered Research Institute, Outcomes Research, at the Patient-Centered Outcomes Research Institute. In this role, she assists the department with a variety of operational and programmatic functions. Before joining PCORI, Rachel was a clinic coordinator for the Richmond Health and Wellness Program, where she managed operations for interdisciplinary wellness clinics located in independent living communities for low-income older adults. Ms. Andricosky received her master's in gerontology from Virginia Commonwealth University. I think very relevant to our symposium today is that Rachel has worked in the past as programs director in a memory care unit. So thank you so much, Rachel, for participating in our symposium.
Thanks so much for that introduction, Carol. And if you give me one moment, I will share my screen. All right, can everyone see that? Great, thank you, Sarah. All right, well, again, Carol, thank you for that introduction, and thank you for having me here today. I will share a little bit of information about the Patient-Centered Outcomes Research Institute, and it's a mouthful, so I will go with the acronym PCORI. And I'll tell you a little bit about the research we fund, and then I will go into a brief overview of two of our research portfolios. So we'll go over our caregiving and our dementia portfolio. And then we'll go through a project together. This project is from both the dementia and caregiving portfolio, and it has results. So a little bit about PCORI. We were authorized in 2010 for 10 years, and we were reauthorized in 2019 for another 10 years. And our commitment to engaging a vast array of stakeholders is evident even in our governing structure, which includes a 21-member board of governors representing the perspectives of individuals across the entire healthcare community. PCORI funds comparative clinical effectiveness research, another mouthful, so again, I'll go with the acronym CER. And comparative clinical effectiveness research is research that generates and synthesizes evidence comparing benefits and harms of at least two different methods. So that's where the comparative comes in. And these two different methods to prevent, diagnose, treat, and monitor a clinical condition or improve healthcare delivery. Importantly, PCORI requires the engagement of multiple stakeholders throughout the entire research process, from topic to development all the way through dissemination and implementation of results. And through this engagement, that's how we can produce evidence that's important to you and important to stakeholders across the entire healthcare community. For all the advances that traditional healthcare research produces, it hasn't always answered the questions that are most important to patients and their care partners. PCORI funds comparative clinical effectiveness research that engages patients, their care partners, clinicians, and stakeholders all across the healthcare community. To answer this three-pronged question, which care options work, for whom, and under which circumstances? By having patients and other stakeholders as part of the research process, instead of only research subjects, we can focus on answering the questions that are most important to patients and their care team. We also aim to produce evidence that can be applied in a variety of settings. And that critical piece, that engagement piece, makes it more likely that we'll get the research question right. That's the first thing. We want to make sure we're asking the right question right off the bat. Two, that the study results will be useful. And three, that the study results will be taken up in practice. So you've heard me a few times saying stakeholders and across the healthcare community. So what exactly does that mean? So I'll ask you to think for a second. Who are the stakeholders that are important to healthcare research? Now, to do research, you do need a researcher. So I have that stakeholder listed here already. But at PCORI, we also believe that patients and consumers and their care partners and their clinicians are critical to the research process. All of the stakeholders, including purchasers, those in industry, those in policy, all use the results from healthcare research and are critical throughout the entire process. So now I want to switch gears a little bit to get to that part where we're talking about our portfolios, and I will go over our caregiving research portfolio first. So while we have 40 studies that include a focus on caregivers of older adults, we don't have any studies in our portfolio that solely focus on the family care partner. For the funded studies, the care partner is a function of the patient. Now, what I mean by this is some of our caregiving studies focus on conditions like cancer or like dementia or kidney failure. And the caregiver might be part of the intervention. You'll see here, maybe there's caregiver training and education. But we call it a gap in our portfolio when we don't have any of the projects focused solely on the caregiver, you know, across conditions, what's important to them. And in our dementia portfolio, we have 13 studies. The most common interventions are provider training and education and caregiver training and education. And similar to our caregiving portfolio, the most common settings are ambulatory care, at-home care, and virtual care. So now, I can share all of this with you. I can give you the numbers, but I want to run through one of our studies to really bring these portfolios to life, so we can really understand what we're looking at here. And this study can fall under the dementia and the caregiving portfolios. The name of the study is Reducing Burden on Hispanic Caregivers of Relatives with Dementia, and the principal investigator is Jose Alejandro Lucinger. The goal of this study was to compare the effectiveness of 2 interventions for Hispanic care partners of people living in dementia. And they were looking at outcomes such as caregiver burden, depressive symptoms, stress, and physical function. The research team engaged community organizations that serve caregivers to help with the design of the study and to help with recruitment. And through that recruitment, they were able to recruit 221 Hispanic caregivers who lived in New York City and took care of a relative with dementia. So that was the population for this study. They were then randomly assigned to 2 intervention groups. Again, that's the comparative part. The one intervention group received the New York University Caregiving Intervention, and the other group received the Resources for Enhancing Alzheimer's Health and Offering Useful Treatments. And it turned out that these interventions worked about the same for the population. So what does that tell us? If we know that they work about the same, maybe someone in one circumstance, perhaps they can only have access to the first intervention. They know that that is just as effective as the other intervention. So this is really important information for folks to know who are looking to use these interventions. And I'll also call to your attention at the end of this slide deck, I have 3 slides of appendices with links to our engagement award studies that focus on dementia and our research studies that focus on dementia. And I believe you'll be receiving the slides afterwards. So if you wanted to explore the portfolio, those are going to be there for you after the symposium today. So I'll start to wrap this up. There's some key things that I hope you take away from this presentation. One is that the Patient-Centered Outcomes Research Institute, or PCORI, funds comparative clinical effectiveness research. This research generates and synthesizes evidence comparing benefits and harms of at least 2 different methods. And patient-centered outcomes research investigates what works, for whom, and under which circumstances. And PCORI engages patients, their care partners, and other stakeholders throughout the entire research process, including dissemination and implementation. And I especially call out dissemination and implementation because it's really important that the results and the evidence that is produced gets out there. We want people to use these results. And all of this, especially the engagement of patients, their care partners, the entire research community, ensures that we're answering questions that help you and other stakeholders make better informed decisions about health and their healthcare options. So that's all I have for you today. My contact information is listed in these slides. And Carol, I'm happy to answer any questions that came in.
Thank you so much, Rachel. So appreciate the overview of PCORI and the kinds of research that you fund, and so appreciate the perspective of the fact that our stakeholders are a critical aspect. And I think, you know, as I was going through my education and beginning to work, it was always what clinicians and what researchers wanted, but now to know what matters to people living with the condition and also their family caregivers or care partners. I do have a question just to start the questions, Rachel. So called the Patient-Centered Outcomes Research. Can you talk a little bit in some of the studies about what outcomes are important to people with a condition or to their family caregivers, care partners that might be different from what we've traditionally looked at?
That's a great question. Thanks so much for asking it. And I do like that you emphasized outcomes here, because sometimes patient-centeredness is, people see patient-centered, and the outcomes part sometimes gets dropped off. So thank you so much for emphasizing that it's patient-centered outcomes. So let's use an example. You know, perhaps a researcher is taking a look at all of the evidence that is out there on caregivers, and they might say, okay, here are some outcomes that are important, such as stress and caregiver burden. And if they don't engage caregivers in their research process, including developing the research question, they might miss something that is the most important to caregivers. And so their results might not be useful to the community who it's supposed to be serving. So with that engagement of caregivers, they might say something like, oh, well, what about physical functioning? That's really important to me. Or managing certain aspects of my daily life, like time management. You know, that's what's really important to me. So it's really important to get that perspective at the very beginning, so it is something you can measure throughout the study.
I see a question, if you wouldn't mind, just to go over it again, Rachel. Thank you so much. And I think just to actually go back to what you're saying, I think we found that in our Stakeholder Advisory Council, as we've been meeting with the different stakeholders, it's been so important to get an understanding of, I thought I knew what was important, but really I was always sometimes surprised that I don't know what's important to families who bring that lived experience and the person living with dementia and the family caregiver. So I love that emphasis on outcomes that matter to them. That's important. If you could just, there was just a question, again, if you could just let someone know where to access the PCORI studies and results. They came in just a couple of minutes late.
Of course. So you will be receiving these slides after this presentation, and at the last slides that I didn't go over during the presentation, I have 3 pages of links to our projects that focus on dementia. So our engagement award portfolio has about 6 that focus only on dementia. And again, these are all links, so you can just click on them. And then the research portfolio as well. So clicking on these links, you'll be able to see a summary of all the studies. But if you're looking, there were 40 in our caregiving portfolio, so I couldn't fit them all on the slides. But if you go to our website, PCORI.org, there's an option to explore our portfolio. So if you click on that, you can search caregiving or whatever topic you're interested in. Those will pop up for you. And we also have them sorted out by projects that have results. So you could search that way as well.
I will also paste a link to the portfolio in the chat box. Oh, Kylie beat me to it.
Kylie. Another question, Rachel, and I think it's pretty important right now during COVID-19 and the global pandemic. Are you seeing different kinds of interventions that people are proposing? And could you speak to that a little bit and how we might make it accessible to people living with dementia and their family caregivers, care partners?
Of course. So specifically related to dementia and their care partners, we did have a funding announcement for project leads to submit enhancements to their project. So Carol, I'll invite you to talk a little about it if you want, but I will just give an overview of, yes, especially during COVID-19, engagement is already tricky. You have to break down barriers, you have to break down stigmas, you have to get a wide group of people with different backgrounds and experiences working together toward a common goal. And it's tricky. And now we can't do it in person. So we've seen innovative ways that people are trying to engage the population they're working with. So whether it's, here's a good example right here. We're all virtual right now. It allowed for people from across the country to tune in. So in some cases, people are even reaching a wider audience than they initially intended because of the virtual environment. But a lot of folks also understand the virtual divide. A lot of people don't have access to virtual means, so they're coming up with innovative ways, just going back to good old mail, mailing out surveys, asking for responses, telephone calls, and things like that. So Carol, I'll turn it back to you if you wanted to speak to that at all.
Yes, we were really honored and excited to have been awarded one of those enhancement awards because and it came from our Stakeholder Advisory Council. At our first meeting, you saw that picture, I think, on one of my slides where we were virtual. We just kind of wanted to update and find out what was happening with our team, and we heard all the different perspectives related to COVID-19 and how it's impacting on dementia care and how important it is that we address that. So that was the topic and is the topic of our enhancement award that we're working on now to develop our questionnaire that really looks at, again, as you talked about, Rachel, how important it is to have all these different perspectives that feed into understanding better a situation, so much better than you can understand as one perspective. And so we wanted to hear from all the different perspectives, from people in long-term care institutes, from families, from individuals, what's been the impact of the pandemic and social isolation on dementia care. So we're moving forward with that as we speak now. So you may hear in the audience, we will be reaching out to a number of you to get your perspectives. And I think there is another question. It's how can caregivers find out about local PCORI opportunities? You may have addressed that with the different links, and we can see. And also talking about, I'd be interested to know, Rachel, in terms of your portfolios, in the question box, it's my mom's primary language is Spanish, I'm bilingual, her voice caregiver is Anglophone, so it's people from different cultures, different languages. And is PCORI addressing culture and the context of different cultures within their portfolios?
That's a great question. So I'll speak to the second question first. Absolutely. PCORI is very interested in taking results and tailoring them to different populations, different needs. So it's something that's extremely important to PCORI because we realize, again, it goes back to that question of what works for whom under what circumstances. So there's definitely opportunities to take tools that have already been developed and adapt them to your particular population. And to your first question, I think you asked what opportunities are around for caregivers related to PCORI. I definitely suggest you check out our Ambassador Center. It's a great way to get involved with PCORI. You'll also be able to see the folks who are already ambassadors. They have a short bio listed on our website. So if you see someone that maybe, maybe they're a researcher and their research focus is caregiving, we have a way for you to connect with ambassadors as well. That's definitely a resource I would check out.
Thank you so much, Rachel, for all of this extremely useful information. And I do think, going back to the culture piece, to me, it really makes sense for comparative effectiveness to look at these different interventions. As you said, maybe something works better in one culture or context than another. And even with our research questions and topics that you're going to hear about later this morning, we've mostly been within an English population. We've now translated and want to see, do the same priorities also come to the top for a different culture? So
absolutely. And again, it goes back to those outcomes. I mean, are the outcomes even important to this culture as well? Maybe something needs to be adapted to make sure you're speaking to what's important to the people you're working with on your research team from all of those different perspectives.
Rachel, thank you so much. This was an amazing presentation, and I think opening to our day to learn about PCORI and also to highlight why really people living with the condition and their family caregivers are really our primary stakeholders, and why we need to know what matters to them as we move forward with our research. So I guess a kind of virtual clap. Thank you so much, Rachel.
Thank you so much for having me. I'm looking forward to the rest of the symposium.
Yeah. So